We will be getting protocols and regulations here in Marin County, and we'll also be giving out information regarding vaccines. So during the second half of the show, we will be also having Dr. Matthew Willis, who is a local doctor here in Marin County, and he's going to be giving us some tips and some information regarding some COVID-19 scenarios that might be coming up. As a high schooler, I know everyone's going back to school now in person, so just knowing what precautions to take, he'll help us understand more. So we're really excited to have him on for the show later. But for now, I'm going to go ahead and pass it over to Annalie for the quote of the week.
Well, good afternoon, everyone. We hope you had a meaningful week. Like Javier has mentioned, today we'll be talking about the pandemic, which made us all have different challenges in life. The quote of the week is, "Challenges are what makes life interesting. Overcoming them is what makes life meaningful," by Joshua J. Marin. And hopefully this quote can relate to all of you guys, that challenges are what makes you grow, change, and become stronger. We may not have control of situations. Example of our previous experiences are shelter in place and school being virtual, but we do have the control of what our response is to it. From when we had the shelter in place and school being virtual, we had more time in our hands. What we chose to do during that time is the outcome of today. So always think about what is your response or the actions you take from a situation out of your control. So yeah, that's my thoughts on the quote of the week. What are your thoughts?
Yeah, no, it's a great quote. I think it's perfect for, especially where we're at right now regarding COVID-19. More people are getting vaccinated. But again, the challenge I feel right now is to get more people to get vaccinated, right? Before, it's kind of interesting how the pandemic has kind of shifted. At first, during peak pandemic, it was like, don't go outside. It's way too dangerous outside. Right. Like you can catch it or whatever. Just stay at home, lockdown, right? Yeah. When we were in quarantine. But now it's transitioned over to, all right, well, the virus is still out, and then there's different variants now. Yeah, right?
There's something that we can do now.
Yeah, and it's the vaccine. But now there's a lot of people who, just don't want to take the vaccine for tons and tons of reasons. But honestly, I took the vaccine because I just wanted to be as back to normal as I can at the moment. And taking the vaccine has really helped me understand, okay, now I'm pretty safe for the most part. I'm not as vulnerable as I was at the beginning of the pandemic, Yeah. Now I'm here.
You have a backup.
Yeah, exactly. I have a backup plan. So, yeah. Or even if I do end up getting COVID, which, knock on wood, I hope I never get it, but it won't hit me as hard because I have the vaccine. So
yeah. Well, I wanted to talk about my experience with the COVID vaccine and also the Berkeley COVID vaccine regulations.
Yeah.
I do go to Berkeley for school, and I've seen the mandate go effect. But the regulation is basically that some businesses require proof of full vaccination of patrons 12 years and older prior entering an indoor business facility. And this went into effect in September 3, 2021. And my experience is I've gone to businesses, stores, where they don't ask me for my vaccine card, but that one time when I went to go eat at a place and I chose to eat inside with a friend, they did ask for me to show my vaccine card because I was eating inside.
Yeah.
So yeah, that's a different. This is a new news that's been happening recently in Berkeley, and I know a lot of people are probably oh, how am I supposed to show my COVID vaccine card if I don't have it with me? Because we do have that card, and I have that card on me. But for references, there is a digital COVID vaccine record that you can go check out online. It's myvaccinerecord.cdph.ca.gov. And you can check, you can write down your information, and then once you submit the application, they will send you a notification, and then they're going to give you your digital COVID vaccine record.
I do want to state something, though, about the digital COVID vaccine is recently, I'll talk a little bit about this later, but my friend who I went to a concert with, he had to show proof of vaccination, and he looked on that website to get his digital proof. and it only showed that he took the first dose, even though he had taken both doses.
Was it recently before?
No, he took it probably when the vaccines came out. He was one of the first to take it. So
that's interesting.
It's interesting because maybe you should always just check it just to make sure that all your doses are there or whatever, because you have to be fully, you have to have all the doses. Yeah.
Before like entering the store, because I feel like it would be kind of embarrassing.
Right. So he was pretty surprised about that, but there were he just brought his card instead just to show the proof. But yeah, sometimes maybe that.
Yeah. Oh, and you can also like take a picture of your card like with you on your.
Yeah, with you on your phone, and that'll be fine. You just have to show ID and all that. But yeah.
Well, my experience as the COVID vaccination, the first dose I did get a fever. I took the Pfizer.
No, you took Moderna, right?
I took the Moderna. Sorry, this is a long time ago. So, yeah, I did take the Moderna, and I did get a fever. It was kind of mild. I did had headaches, so I did rest like a day, and I did get shivers. And then the second dose, it wasn't that bad as the first dose. I know a lot of people had it worse than the second dose, but mine was kind of different. I did have a sore arm, which is normal, and I did have a fever the next day. But the second day, I was like up and running. I remember the second day we were in the healing circle thing event that we had to do. So I was
you were
okay.
feeling also,
Yeah, I was okay. But yeah, that was my experience. But what was yours?
Well, yeah. So for me, when I took the vaccine, the first dose, I took Pfizer, and when I took the first dose, I felt nothing. Like after, like I didn't feel. All I felt was like a sore arm, and that's pretty common. But other than that, I took the second dose, and then that's when it really hit me. It was like, oh, whoa. Like the next day, like at night is when I felt it. Like as soon as I was going to fall asleep, I started getting shivers, and I got really, really warm.
All right.
And it was just like, it was kind of scary, not going to lie. But then the next day, I just felt like out of it. Like I felt like I couldn't even like do proper things. I just felt like I was sick, you know?
Yeah. And I remember they told me not to take ibuprofen.
Yeah, so, apparently that's bad. It doesn't actually help at all.
Yeah, so it's best not to take it.
Yeah. But after, that intensity only lasted for that one day.
Yeah, so it's quick, but it's bearable,
Yeah, like maybe even plan out when you're going to take the first dose and the second dose.
Yeah, and take a rest day.
And then you plan it for the weekend. So then maybe in the weekend you can rest and just work around your schedule. Because I think that would be the best. Like as much time as you can have to like rest and be like comfortable while you're like during the second dose or first dose, whatever dose, you'll be fine. Because it'll make the experience less like annoying for you, because you're like, oh well, now I can't go to work or go to school because or I have to miss this because
so much responsibility.
I feel bad. Yeah. But I did want to mention that back to like regulations. So similar to Berkeley, like you were mentioning, everyone who is 12 or older in San Francisco must show proof of vaccination in order to get into certain businesses or to eat inside. Fully vaccinated, just to let everyone know, means 2 weeks after your final dose of the COVID-19 vaccine. So, if, for example, I know J&J is the one that is only one shot, but so you would have to wait 2 weeks after that one.
Yeah,
but
J&J is Johnson & Johnson.
Johnson & Johnson, yeah, sorry. Yeah, and then Pfizer and Moderna are the 2-dose options. And again, so for those, it would be after your second dose. 2 weeks after that means you're fully vaxxed. So that's just some clarification on that. And like I said, San Francisco is requiring proof of vaccination for the following areas. So bars, restaurants, clubs, gyms, large indoor events, and any business or events that's serving food or drinks indoors. So mostly anything like indoor related, and I also wanted to give out my recent example is that I went to go watch a concert about 2 weeks ago. It was my first ever concert since like the pandemic hit, I went to go watch Tame Impala. And I was supposed to watch them last year in September, but the pandemic was like peak pandemic during that time. So they had to cancel the show, but now they rescheduled it for this year. So I went, and it was at the Chase Center, where the Warriors play, and it was awesome. I really loved the Chase Center. It's such a nice venue. Like, if you ever get a chance to at least see a game over there or go to an event at the Chase Center, I highly recommend it because it's just so nice. Obviously, all the food's overpriced because it's just stadium food. Like, I had to pay $20 for a sandwich with no sides or anything, and a water was $6.
Oh no!
So, yeah, maybe eat something before you go to a concert or the Chase Center. But anyways, the way they were doing things there is you would have to either be fully vaxxed to get in, or you would have to show a negative COVID test prior to the show within 72 hours of the show. And what was actually kind of interesting is that next to the Chase Center, they had testing sites. Yeah, they had testing sites. So let's say you forgot or you didn't have time to do a negative COVID test and you're not vaxxed.
Yeah, that's so convenient.
Yeah, they give you the option. I know also a friend who was working at the Napa Valley music festival that happened last month, I think, too. And they had the same thing. A lot of venues have testing sites literally on site. So they're taking the proper precautions, and I mean that made me feel pretty laxed when I was there, and it just made the experience much more enjoyable because I knew it wasn't people sneaking in or anything without So it was fine. It was really simple. They just check your card and you just go in and basically and then you have to keep your mask on inside, but still it was nice. It was nice. Especially being surrounded by so many people. I was surprised. Everyone was wearing their masks. Everyone was really following the rules. So they're pretty strict and pretty enforcing it pretty well in the menu. But yeah, it really felt refreshing to be just in a concert again and be able to be there. Yeah. Are you planning to go on to any concerts?
Well-being, safety. Yeah, safe. Yeah. Well, for me, I haven't. I haven't gone to any concerts. So.
Have you ever gone to a concert before at all?
I don't think so. I don't remember
really?
Any. No. Oh, I did go to a Monster.
Is that the K-pop band?
No, it's no concert, but it's this car show. These
like the monster trucks?
Yeah.
Oh, okay.
Monster. But I was so little, but that's all.
I like how I thought that was a K-pop band. Because all those K-pop bands have just like that. I wouldn't be surprised if there was a K-pop band called Monster or something.
Maybe,
but okay.
Maybe
there is. But anyways, we'll be right back. We're going to play a quick PSA and we'll get back to you guys.
Pacific Gas and Electric will turn off electricity when there is extreme fire danger to reduce the risk of wildfires. Marin residents need to be ready in case of prolonged power outages. First, you can sign up to get notifications about planned power outages. These will tell you when the power outages are likely to happen and how long the power will be out. To receive notifications, text your zip code to 888777. Second, be sure to have a working flashlight, enough food and water for 3 days, and other necessary items stored in your house and/or your car. Third, learn about how to prepare to keep your family safe in case of a wildfire or extended power outage. See emergency preparedness information on the readymarin.org website. Please text your zip code to 888777 to get on the alert system today.
All right. Well, welcome back, everyone. As you all know, it's gotten super duper hot here in Marin County. It's October already. It's October 1st. And it still feels like it's summer out there.
Right.
I don't know. I was doing some filming earlier today outside, and that heat was really shining down on me. It burned.
Yeah. Well, for me, I walk the campus. When I go to the campus, I walk everywhere, and it's so hot, and it's just really bad.
I agree. So, it's really bad now.
Yeah, just keep yourself hydrated.
Yeah, hydration, and also just, again, make sure that you're prepared for when wildfire does occur, because, it's just unfortunately here in Northern California, they're really common.
You never know when it's going to happen.
Exactly, and you always want to be prepared, because you don't want it so that when your house is about to burn, that you have to literally pack all your stuff up or sacrifice some things, so that really sucks. So
think ahead.
Yeah, think ahead.
But yeah, well, for me, I'm going to talk about some protocols in Marin and some locations to get tested in Marin. So some protocols in Marin is first responders are required to have vaccination. Indoor places require masks, and you can take off your mask if you're actively eating, meaning you're eating. But to make it more simple, like if you're drinking and you're just taking a sip and then talking, that's not actively eating. It's best if you take a sip and then cover your mouth, and then cover your mouth with the mask. Yeah.
Mm-hmm.
And then you can take off your mask when you're alone in a room. And there's more listed on the website on coronavirus.marinhs.org, and then it's in health orders.
And I just thought it was funny that one of the things that they put down there is showering.
Yeah.
Like,
I was gonna say it, but
no, I wanted to mention it anyways, though, because that's pretty funny. Like,
yeah,
I'm not gonna shower with my mask on.
Yeah.
Like, what?
But it's there. And there is the isolation quarantine order, and they have more information about that on how you should isolate and stay in your room, or in the place that you're in, so you can keep yourself safe and others safe. And then the CDC does say that after you're tested positive, you can if you continue to have no symptoms, you can be with others after 10 days have passed since you had a positive viral test for COVID-19. And the COVID tests, there's different tests that you can take. There's tests given from healthcare providers, community-free testing sites, and you can also take a test at home. You can have it delivered at your house, and then you take it and then drop it off to the mail.
That's pretty useful.
Yeah, I think that's convenient too. And I did want to mention some community-free testing sites. There's one that is recently coming up. Today is Friday, the day that we're recording right now. And Monday is the most recent or the closest site you can take your COVID test for free. It's on Monday at 10 a.m. to 4 p.m. in Marin Health and Wellness Campus. It's at 3260 Kerner Boulevard, San Rafael. And you can also look up their location through the coronavirus.marinhs.org/testing. And then I'm going to mention a few more, which is the Novato Library. It's on Fridays, 10 a.m. to 3:30 p.m. And then there's Piper Park at Larkspur, Thursday at 10 a.m. to 3 p.m. And yeah, that's it for my spiel.
Well, no, thank you for that information.
Yeah.
I honestly didn't know about. I'm glad that they're still making COVID-19 testing
For free.
for free
Yeah.
and widely available.
Mm-hmm.
Because even though I feel like a lot of people haven't been getting tested as much as before because of people getting more vaccinated now, and it's still good to just take it if you're feeling like strange or weird, or you feel worried. Because I know it definitely happens. And there's all sorts of COVID-19 sites, like you just mentioned, that are giving that opportunity to people. Because, you got to wait 10 days anyway. So you might as well, use that to your advantage to make sure that you're not positive again, right?
Yeah.
So, and just moving on from COVID-19 testing, as for some resources to where to get vaccinated, I did want to note that as of, October 1st today, the current vaccine that has been approved for children over the age of 12 and up is Pfizer. So Moderna and Johnson & Johnson are unfortunately are only available for people aged 18 and up. So Pfizer, like I mentioned before, is a vaccine that I ended up taking. And like I said, I didn't really feel anything for the first dose, but during the second dose, I felt like pretty bad. But again, it doesn't last that long. Like the pain or the fevers, none of it really lasts for all that long. But just note that these are the Pfizer vaccine is the only vaccine you can take if, let's say, you're a current high schooler or you're like a middle schooler who's going in and wants to be vaccinated, because I highly recommend just high schoolers getting vaccinated, because I understand that you guys are pretty exposed to a lot of people like every single day. So as for places that you can get vaccinated, the website that Anna Lee actually mentioned, the coronavirus.marinhhs.org, also has a vaccine finder as well, where you can look and up various sites to get tested at. One of the ones that's on there is one that takes place at the ferry terminal in Larkspur, and they offer Pfizer at that one. So if you're a high schooler who's looking into, or a middle schooler, anyone who's 12 and up, who's trying to look for to get the Pfizer vaccine, you can get it through that website by going and searching up for the ferry terminal service. And it's very, very, very quick. Like, you just go in your car, or you can have your parent drive you, and you never get out of the car. You just open your door, you roll up your arm, and they just put the dose, and then you come back 2 weeks later for the second one. So it's pretty
I did wanted to mention that, like, you will need parent consent since you're a minor to get that test, COVID-19 test. So
and same for the vaccination. Thank you for mentioning that.
Sorry, the vaccination as well. But yeah, just make sure you talk to your parents and let them know, like, what you're thinking, or what's your decision with the COVID-19 tests.
Yeah, because you can't just show up with your friend or something and then
they won't give you the vaccine.
Yeah, because they check for my ID when I get there and everything to just make sure that I'm of age. But yeah, that definitely. So speaking more about that vulnerability that I was talking about, where children, really, like anyone under the age of 12, is really like the most vulnerable and the most susceptible to spreading COVID-19 right now, because, well, they can't get vaccinated. And they're in an area that's less vaccinated, exposed, because literally everyone around them isn't vaccinated. Like kids under 12, like preschoolers, elementary schoolers, they're around people who aren't vaccinated like literally all day, because schools are opening back up again. So that's why it's a big responsibility for the teachers to get vaccinated, because they're the ones that are also exposed to them all the time. And I wanted to just mention that even though Marin County is actually one of the most has like the highest vaccination rate of, I think any county here in America, like literally the whole United States, there was still a very major outbreak here. So this made worldwide news, but what happened was an unvaccinated teacher caused a COVID-19 outbreak.
Was this news here?
Yeah, it happened here in Marin.
Oh, okay.
Yeah. The unvaccinated teacher caused a COVID-19 outbreak in an elementary school, and they ended up getting 22 students infected with COVID. It was really bad because, the only way the way it kind of spread was that the teacher, they would all be wearing masks, but the teacher would put down their masks during when they would read. So when they would read them a story or something, they would put their masks down.
And the kids were not wearing masks?
And the kids were wearing masks. Okay. But it's interesting because 22 students isn't the whole classroom.
Oh.
So kids in the back of the classroom got infected, and kids in the front of the classroom got infected. But a good amount of like the kids in the middle didn't get infected.
Maybe they were washing their hands.
Yeah. So it was actually, that's why it made worldwide news, is because it was a really interesting case study. Right? Because they were like looking at like, it shows that masks are pretty effective, because if they weren't, everyone in that classroom would have been infected with COVID. Right? But yeah, it was very interesting to see. There's plenty of charts on it. Like literally, if you search up COVID-19 elementary school outbreak Marin County, you'll find like all the information and data on it.
Wow. Well, it just shows that like you never know what's going to happen. So like always be careful. And honestly, I want to say it's not the end of the world if you do get COVID. I think you can get through it, hopefully.
Most young people, I'd say, can get through COVID pretty well. It's just really, I mean,
There's a risk.
there's a risk factor of getting your parents infected or people who are old. That's the real thing, right?
Mm-hmm.
I mean, but that's what's been shoved into our brains for literally
Yeah.
the whole pandemic, is that the whole point is that, younger people, if they get it, they could just survive through it, right?
Yeah, but everyone messes up, so it's okay. Like, if you mess up, it's okay. Like, you'll get through it too. I just wanted to mention that mental health has been a playing factor in the pandemic, and like, everyone does mistakes, and it's okay. Yeah.
Yeah, no, because I get it too. Like, I totally get it, like, wanting to go back to school. I mean, I think that's great. I think it's awesome that people can go back to school like you. You're going back to Berkeley. You can actually go to the Berkeley campus.
Yeah. But it's important to be safe and informed as well.
Exactly. And as long as you're, like, again, around... If you're vaccinated, it's even better because you feel so much more safer outside and you feel like you're not going to, like, infect anyone or get infected. Because the whole point of it is you want to just... keep things as safe as possible and spread reduce the spread of the virus.
Yeah, and have responsibility with yourself that you need to protect yourself and others as well. So yeah, that's what I wanted to say.
Yeah, and definitely just respect
others'
decisions to whether or not they wear a mask or if they're wearing a mask because they want to keep their loved ones safe,
Yeah, and also, like, respect the other people who are asking you to put on your mask when you're in a building, because their role, like those who are in charge of the buildings, their role is to keep everyone safe and everyone being able to be in that building. So just be respectful of that too.
Exactly, and being the more that people respect each other and understand that we're doing this literally to keep everyone safe and to go back to a sense of normal, we'll be stronger and better as a community, really, as a whole nation. But yeah, like going back to that story, I still think it's very important that you at least teach your siblings, like if you have little brothers or little sisters, or even cousins, nieces, like anyone who's under the age of 12 and that they're close to you, to just teach them how to wear a mask properly and to always keep it on.
Above your nose.
And just keep everything like, let them really sink in. Because kids are smart. I mean, kids under 12, they soak up information like a sponge,
Yeah.
So, I mean, they'll keep them like nice and in check if you let them know how to properly put on a mask and stay safe and not just, create a risk of being infected. So, yeah. But anyways, we're going to go ahead and go on and play a song by Ismael Lara, who was on about 2 shows ago. He is a local up-and-coming artist here in the Bay Area. If you haven't had a chance, you could go check out our interview with him. That's up on our Spotify, Instagram, Facebook, and YouTube. But here's his song called Walking Stars, and we'll be right back.
With you by my side.
Yeah. In the whip, thinking of your smile and your perfect laugh, I know you're still alive. Cause I feel presence next to me with you by my side. I'm indestructible, more powerful. I'm gonna make you proud. Saying I don't wanna one south. Fast tracking through the Golden Gate, trying to get home a buy. I know everything's gonna be alright. This last week I seen you in my dream, and you said it ain't bye. You said don't shed no more tears. I just want you to know these sparkling tears contain core memories that spark the projection from the fondest memories of my life. Each tear's a flashback. Each tear runs down my face like a half bag. I celebrate them. This path I was meant for. Pain and lessons, gifts from the heavens, no longer question. They strain my bond, my sons, so we don't commit the same mistakes in the strange cold game. To transform darks to light, we meant for. To help others spark they shine, I was made for. I am king, gradual unconditional love is what evolved my wings. This is how I flew out of eternal purgatory. Changing my patterns to aviate to fly patterns. Move through the cosmos like the Green Lantern. With you by my side, I'm afraid to fly. With you by my side, I feel the urgency to truly live life. With you by my side, I understand we don't ever really die. We walk in stars destined to rise. We rise.
All right. Well, welcome back. Again, we hope that you enjoyed that song. It's called Walking Stars by Ismael.
It's really good.
Yeah, it's really good. His EP, which is called Walking Stars, is available now. You can still find it on Spotify, Apple Music, all those major streaming platforms. And he's also selling merch as well. So we'll tag him in the post for this show if you're interested in buying merch and just supporting him, because I think he's a great artist. And again, if you are an artist local here in the Bay Area who wants to be on the show, well, feel free to hit us up, and we'll be more than happy to have you on for the show and get to know you and play your music.
You can contact us on Tay Radio Marin on Instagram, TikTok, basically
all of our, literally like every single social media. We're on there. But yeah, all right. So now, without further ado, we have our guest for the show. We're very excited to introduce him. His name is Dr. Matthew Willis. And we are so excited to have him on. Hello, doctor. How are you?
Great. Great to be with you.
Thank you so much for being on the show with us today. It really is a pleasure to have the chance to talk to an actual doctor and get some information and get some of our questions answered by an expert. So we really appreciate your time here.
Yeah. Would you like to introduce yourself to the audience?
Sure. Yeah. So I'm Dr. Matt Willis. I'm the public health officer for Marin County. So I work for the Department of Health and Human Services, which is the largest department in Marin County government. So I am a public servant. My salary is paid for by taxpayers. And I am over the health side of that large Department of Health and Human Services, about 700 employees in that department, about 200 in public health. And that's our team. And really, over the last 2 years, it's really, as you know, been primarily focused on one disease, one response, and that's been the COVID-19 pandemic. Our team has grown over the past year and a half as we've kind of upscaled to match the demand for services related to the pandemic response. I'm happy to be with you today to talk about that experience.
Awesome. And I was reading up on you, and it seems that you've worked for the CDC at some point, correct?
That's right. Yeah, my background is in internal medicine. I spent the first part of my medical career in primary care, seeing patients. I had my own panel of patients first in Boston, and then I worked on the Navajo Reservation in Northeast Arizona for 4 years. Have a strong value of ensuring that everyone has access to the highest attainable standard of health, regardless of their background. So health equity is an important priority for us in Marin County. And it's really one of the things that personally drives me in our work and has really informed our pandemic response. And after working on Navajo, I went to the Centers for Disease Control and Prevention in Atlanta. Spent a couple of years there doing international tuberculosis and HIV research and outbreak controls. I was in Haiti after the earthquake, helping design the system for detecting and preventing outbreaks in the tent camps, and then found my way back to Marin about 8 years ago. I grew up here, found my way back here, and have loved my role as a public health officer since then.
Oh, well, that's pretty cool. I'm actually trying to major in public health as well, so it's very fascinating to hear your journey as your medical career, and it's pretty cool to see you serve the people and helping them. Well,
stick with it. I can always say, you or any other listeners, public health is awesome. It is such a great path. It's so rewarding it's rewarding to treat people who are sick, but it's even more rewarding to prevent sickness and keep people well.
Mm-hmm.
Yeah. I'm actually striving to help those who are in the minority groups and low incomes because they need the most help as well too. And yeah, it's very interesting to have you. I'm very grateful that you're here taking time to talk about the pandemic, and especially since you're a public health doctor. And well, my first question is, when COVID cases were rising in China, were you concerned that it would reach as it did in the U.S.? What are your perspective as a public health officer?
Yeah, we were, obviously concerned when we saw what was happening, and that just seems like such a long. It's hard to imagine that was only just over a year and a half ago. It feels like 5 years ago or something. But the World Health Organization is constantly looking for emergence of new infections or odd outbreaks that might be happening anywhere in the world, and they'll send out announcements every once in a while when something crosses a certain threshold of concern to say, hey, we're seeing this happening in Africa or in the United States or in China. and just to kind of have the global medical community be aware of what might be occurring and to stay tuned. And that was kind of the first communication, like end of December, early January. They're saying, we're seeing this odd increase in this respiratory illness out of Wuhan, China. Not sure what to make of it. And I remember having an email exchange with Dr. Lisa Santora, our deputy health officer, who's amazing. Yeah. And Lisa and I were like, should we include this in our like weekly update to our clinicians, our little newsletter that we send out? Should we include some mention of this? And we decided we should probably just signal this as something for the clinicians to be aware of, not knowing at that time that it would become just like the dominant theme for the entire world. But what we saw very quickly was that it was spreading so quickly in China, and anything that spreads that fast has the characteristics of something that could become a pandemic. So at that point, we knew we needed to kind of brace ourselves for, just because of the global economy, the global nature of travel and things. Right. Anything that affects one place is going to affect every place soon enough. No place is an island. And we started seeing cases, a couple months later. Our first case in Marin was in early March. Lucio Hernandez, a gentleman that we got to know because we only had one case. So we had a lot of attention on that case for a little while. He ended up in the hospital, ended up also being our first death, unfortunately.
Dang, wow.
And that was really a wake-up call for us to respect this, to really understand that we're dealing with something that is serious and is affecting our own community directly.
Wow, thank you for sharing that. That's actually really eye-opening. I didn't know that the first COVID case actually was a death too.
Yeah, because for me, like I was in school and I heard about the COVID cases in China, but I didn't think it was that serious. And then March came and it was just big news.
Yeah, like that whole like March and April was really like it was scary. Like we didn't know what was going on really, or and then we just kept seeing cases go up and up and up, and we saw deaths going up. And I mean, it's just I can't believe it was just like about a year and a half ago now that happened.
I was I ended up being the 39th myself, the 39th case in Marin County.
Wow.
Of COVID-19, because there's so much we didn't know about how it was transmitted at that time. I was out in the field working with our hospitals, our emergency medical services providers, and somehow ended up contracting COVID-19. Right. And so I think that also really kicked me, like I was for about 2 weeks kind of just at home in bed. Yeah. I've never been that sick in my life. And that I think also kind of informed my understanding of what this disease can be, and really wanted to protect our community as much as we could.
Well, on the subject of COVID cases, how many COVID cases are there currently here in Marin County, and should we be concerned about them?
Yeah, so right now we're at 14,840 cases. We track this very carefully, so at any given day, you can get an answer to that question. You go onto our website at coronavirus.marinhhs.org. And it has all the daily numbers. It has hospitalizations, case rates, death rates, and a lot of other information. It's information that I use to guide our strategies, but it's also anyone who wants to see what's happening in the county. So that's our current almost 15,000 cases, 191 deaths. And should we be concerned? I think, the answer is we should be concerned enough that we are responsible, that we're sensible, that we're responsive. But I think you can turn towards being, so afraid that it actually creates other kinds of harm. And so we also need to recognize that we now, with a year and a half into this, we know a lot about how to control it, right? We know a lot about how to protect ourselves. We have tools for protecting ourselves. We know that facial covering is critical. We know that vaccines are critical. So there is some measure of control as well. So I think, yes, it's important to be concerned, but for that concern to lead towards being responsible in your own behaviors and recognizing you do have some control over your risk.
Right.
Mm-hmm. Well, we know that it lasted like more than a year with the pandemic, and I wanted to hear your perspective. Like, how long do you think the pandemic will last? Do you think it's coming close to an end?
Yeah, that's a great question. I wish I had a crystal ball to answer that question.
I think we all would appreciate that, huh?
Yeah. But there's two ways to answer that. One is that the term pandemic right, has a specific definition. A pandemic is like a global epidemic. So an epidemic is when it happens locally. Pandemic is when it happens globally. And pandemic is characterized by something that is new, that is across the entire globe, and has a high burden, right, high risk. And so for us, we are probably moving out of that pandemic definition locally because we have much better control. We have very high vaccination rates. Our case rates are declining. And we are moving towards adding COVID-19 to be among those other lists of diseases that we've come to know and just live with, like flu.
The flu,
measles, tuberculosis, HIV. There's a whole list of communicable diseases that we know how to manage. Other parts of the world are still really in the middle of that pandemic phase, right? Because they don't even have vaccines yet. And there's cases are going, still very high case rates. So I think the term pandemic will apply to this for at least another year for the World Health Organization. Our local experience will be more what we call endemic, which is kind of when it becomes more local, probably in the early part of 2022.
All right. Well, yeah, I think, it makes sense what you mentioned, that right now we're kind of just going to be we've known for a year now how the virus spreads and just overall how to deal with it more now, especially with the vaccines now being rolled out here in America and more people getting vaccinated. It's like you said, it's just going to have to be another one of those diseases that we're going to have to live with and just understand that, this is just going to be a disease that exists. And well, thank you for mentioning that. I wanted to say also, so since there's been lots of misinformation being spread around, especially about the vaccines and about just COVID-19 in general, many teens and people in general are still hesitant about taking the vaccines. And I was wondering, how can we as young people try to help people understand that the vaccines are safe, or try to at least educate them in a way where they don't really believe all the misinformation that's being spread on social media? Because obviously there's a lot of it, and it's real. There's a lot of people that are scared to take the vaccine. So, if you had any suggestions on how,
I mean, I think the first thing is to recognize that it is, I can see how people would be confused and not sure. Because there's a few pieces. That one is just even within kind of the established government. The way this came forward was so politicized, right? It was under one presidential administration, and then it's gone to another.
Yeah.
And so the politics around this has, if I step back, I think one of the most unfortunate sort of when we look back on this, 10 years from now, 20 years from now, just that the politicization of this pandemic will be, I think, one of the most unfortunate features of this, because it has prevented us from really having a clear view of the truth, right? Of whatever is true about this, whatever is natural and true about this virus, from a science standpoint, the things we try and determine through studies and really careful analysis has been so obscured by all of this kind of political.
Exactly. It became very political.
It leaves the public often confused. So I just want to start with, empathizing with that experience.
Mm-hmm.
I think, we're still fall back on, looking to established sources of reliable information, rather than looking to, the internet, just to search on the internet or just social media. I mean, anyone can say anything in those forums. And then they sort of get a life of their own because they find people who have those shared beliefs. And then it kind of becomes its own little online community of believers or something that could be completely false.
Mm-hmm.
And that's, I think, the nature of a lot of that information is this group think around people who are completely separate from kind of science, and can really harm us. I find it's one of the hardest things about my job is to be an effective communicator when people are bringing me what they see as science, but it's completely false.
Exactly.
Right? So I think so. The CDC, Center for Disease Control Prevention, is a reliable source of data and research and science, and they make the regulations, they make the policies. That's where I look. World Health Organization. That's where I look. Marin County Public Health, we strive to be trustworthy and transparent. And we try to communicate as clearly as we can. And I think people can look to us as a source for information if they're confused. Our website has a lot of information. We do a lot of, I speak to the media. We try and do everything we can to offer clarity. And then the other is that, finding someone that you trust in your community, a physician, your doctor, a nurse, someone within the medical community who you trust, and having that one-on-one relationship. So if someone has concerns or doubts about the vaccine, don't hold back, don't hide, just come and just share what you're feeling, Everyone has a right to their own experience.
Exactly.
We want to be respectful.
Most definitely.
And I think having a conversation with the healthcare provider is also an important potential tool for people who are on the fence.
All right. Well, thank you so much for the information. And we wanted to ask you some scenarios. So if someone is in this scenario, it can help them. So I wanted to say, let's say I'm in a group of 4 people and 3 of those people are fully vaxxed. Is it safe for me to hang out with them inside a place without masks?
Well, I guess that's an easy one. No, not inside. So, that you have three who are vaccinated, 1 who is unvaccinated. That's kind of I'm really glad that you asked that question that way, because that's a really common scenario. When we see breakthrough infections, breakthrough infections are people who are vaccinated who get infected, right? Good news is that when they're infected after they've been vaccinated, it's a much milder disease. They're not as nearly at high risk for getting hospitalized. The vaccine has really prevented them. But even in those cases where those occur, it's often because there's someone in that environment who is unvaccinated, and they share that space, which is why we're asking people who are both vaccinated, unvaccinated, and vaccinated to cover their faces in indoor settings when they're in mixed gatherings like that. That person who is unvaccinated, unfortunately, really does, just from a epidemiologic standpoint, present a risk to those around them, because they are much higher risk of being infected and being infectious because they don't have the protection of the vaccine. And we know the virus is still part of the community. So it's possible, it's much more likely that person could be infectious. So the answer is, unfortunately, for all those individuals, they should all be covering their faces indoors. And that person who is unvaccinated, it would be even safer if they're able to maintain 6 feet distance from the others.
Yeah, I remember when we had the order of that we can like those vaccinated can go to the indoors with no masks. And when that happened, there was so much COVID cases. And I believe it's the same reason that you just mentioned, because
it's a mix, of unvaccinated, vaccinated people.
Some people go into the store not vaccinated
with no masks. That's the other issue, right? Is that how are we going to even check for that? That people are vaccinated who are walking in with no masks. How do we know that they're vaccinated, right? But yeah, I mean that's a whole other thing. But
I'm glad you mentioned that, because a lot of people misunderstand what was behind that mask mandate. Mm-hmm. That mask mandate was really to make sure that if you're in an indoor setting where you got a mix, everyone's covering their face. Mm-hmm. And it's a very simple rubric. You just got your face covered, because when we say that one group can not cover their face, it's really the unvaccinated people are often less willing to cover their face than vaccinated people.
Exactly.
And so it just offers that more global protection for everybody.
Right. And going on to another scenario, so we've been speaking about indoors, but let's say that I'm fully vaccinated and I wanted to go, let's say, for a run or be outside around, I know in San Rafael, they do that dining under the lights thing on 4th Street where they close it down and everyone gets to eat outside. How safe is it for me to be outside without a mask if I'm fully vaccinated?
Yeah, I mean, generally safe, but it depends. It depends on how close you are to people and who those people are and whether they themselves are covering their faces. So I would say it's generally safe. If you're out on a run and you're alone and you're vaccinated, you don't need to be covering your face. Sometimes I see that, I'll be up on a up on a hike on Mount Tam and the person is like walking along with a face covering and there's no one around them. I think sometimes we can maybe take it a little too far, but in general, if you're around, I would say you should cover your face, even if you're vaccinated outdoors, if you're in close proximity to people, especially if it's a mix of people vaccinated and unvaccinated.
Right. Okay. Well, thank you for that clarification. Because, more recently I started running without a mask outside. I was wearing my mask while I was running outside, but usually the area that I'm in is very little people at all. So I'm like, I think I feel like I can just wear it, and I felt a little more secure about it too since I'm fully vaxxed. So, I think your reasoning makes sense. So thank you for clarifying that.
Well, here's a specific scenario that I'm going to read out. And it says, someone is sick and has COVID, but they don't know they have COVID yet and is wearing a mask in public. If I'm near that person and I'm fully vaccinated, but I'm wearing a mask, what are the chances that I can get COVID if I wear a mask and when I don't wear a mask?
It's a very specific scenario.
Yeah.
All right. So you're vaccinated, but they're not vaccinated.
Yeah.
Or they're sick.
Yeah.
But they haven't been diagnosed yet. Okay. So that happens, right? Someone gets sick, haven't been diagnosed yet. They're out in the world and they're not covering their face. Or no, they are covering their face.
They are.
They are covering. Okay. So great news. So that the fact that that person is infectious to others, does not know yet that they're infectious to others, which is how it happens in real life. You obviously don't know until a little later. That's why we cover our faces just at baseline, because you don't know. And if that person had their face uncovered, the risk of transmitting to others around them would be so much higher. So the fact that they're covering their face already, you drop your risk of being infected by 70%. They're covering their face drops your risk by 70%. And if you are also covering your face, your risk drops by like another 25%. So you're benefiting each other. We call that mask on mask. So it's when both parties, one infectious, one susceptible, they're both covering their face, the risk drops like together by about 90%, 70% on one side, about 20% on the other side. So it's you are significantly protected by the mask that you're wearing, but even more importantly, you're protected because they were wearing their mask.
Great.
That's good news.
Yeah. Well, thank you. And then just one last scenario here that I want to throw out was, so since a lot of concerts are opening up again, how safe is it for, a lot of these concerts now, the venues are requiring people to either show proof of vaccination or also showing like a negative COVID test that's within 48 hours or 72 hours of the event. How safe is it for a non-vaccinated person to go to one of these concerts without a mask, but showing proof of a negative COVID test? They would be surrounded either by, either people who are fully vaxxed or have also shown proof of a negative COVID test, because obviously that's the only way they could get in. So, yeah, how would that play out for them?
Yeah, I mean, I think that, stepping back, that person who is unvaccinated is at risk wherever they go and represents risk to those around them wherever they go. A concert increases that risk because there's others closer around them. That's mitigated a little bit by the expectation from a policy standpoint that people show proof of a negative test. But then you're talking about when was that test done? What is the accuracy of that test? How much can we really lean into that negative test as proof that that person is not infectious?
Right.
It does add some level of safety that they have that negative test. But I think all of these are measures, these layered strategies to reduce risk overall. And the most important thing there is that person would be safest overall and be safest those around them if they were actually moving from an unvaccinated state to a vaccinated state. And the proof of the negative test adds some security, but it doesn't mean that person is not at risk to those around them.
Would their risk go down in any way if the concert was done outside instead of inside?
Yes, absolutely. Yeah, outdoors is ventilation. We're learning more and more. I mean, this is a respiratory illness, so it's spread by droplets in the air. If you think about a closed room with no ventilation, stuff that people breathe out just sort of starts to accumulate there. So that's kind of the one scenario of like why it's so much riskier indoors in poor ventilation. The opposite of that is an outdoor setting that's well ventilated, where the particles will just go up into the atmosphere. And that's why we're seeing that outdoor settings are really categorically just so much safer than indoor settings. So
Right.
yes, absolutely.
I have a question that came up in my head. When you're sick, when you take the COVID test, does it have, like, is there a certain day that, like, let's say you're sick and then 3 days you take the test, and the test is on, like, how long is the test able to detect COVID-19? That's the question.
Yeah, that's a great question, because it's sort of it can be confusing. When someone is exposed, we might say, okay, we've learned that through our contact investigation that you were exposed to someone with COVID-19 yesterday. And they're like, good, I want to go get tested. And we have to say, wait, don't get tested yet, because it takes a few days. After you've been exposed, it would take generally about 3 to 5 days before, if you had been infected through that exposure, for the virus to actually build up enough particles in your nose, which is the test, right? Usually goes into the nose, to detect if you were infected. So sometimes if we get tested too soon and it's negative, you might be falsely reassured that you haven't been infected when in fact you had. So the message is usually to wait at least 3 days after any potential exposure to get tested. And we require that people test negative at 5 days. The earliest you could detect it in 3 days, but we really require a negative test at 5 days after a known exposure to be able to make sure that you're out of the woods, that you were not infected.
Wow. Well, thank you for that. Because actually, well, just to be honest, I usually just take my COVID test like right after I start feeling something, like if I feel bad or if I feel certain wrong. But no, thank you for explaining that, because that makes more sense as to why it's recommended for people to take the COVID test at least.
Well, I want to be clear there that for symptoms, so that was the relationship with what I just described as if someone's been exposed. So let's say you're at school and you got to wait at least 3 to 5 days after that potential exposure. If you're having symptoms, you're right, Javier. That's when if you're having symptoms, you should take your test right then.
Okay, thank you for clarifying.
Because
that.
That's the symptoms. If the symptoms are actually a sign of COVID-19 infection,
like it's
a
already
really good
in your
time
body.
to take the test.
Yeah, exactly.
You're gonna have viruses in your nose.
Exactly. Okay. All right. So I guess I'm not in the wrong.
You're good.
Okay, I'm good.
You're right.
All right. Well, perfect, Dr. Willis. Is there any last words that you'd like to say to our audience? I mean, it's been great having you on here. This has been, again, so much good information that has made me feel a little better about kind of like the situations that I sometimes put myself in. And just having your expertise answer those questions for us has been really helpful. So are there any last words you wanted to say to our audience before?
Well, thanks for having me. Yeah. And we think that, just direct communication and honest exchange is critical to our response all the way along. And so I appreciate this radio show and a chance to talk with you, and we can come back at intervals, as things come up. Marin County is I feel like we're doing well overall with this pandemic response. We have some of the highest vaccination rates and the lowest case rates, some of the lowest death rates. We just did an analysis that showed our death rates are about 1/10 of what they are across the California as a whole. And it's a chance to reflect on what are the elements of that. Obviously we're still grieving all that this has meant for us. We've lost a lot, both in our own personal lives. Businesses have been lost, lost school days. It's been really hard. We've lost family members. So it's hard to say anything that would be a celebration of any kind in that environment. But I think it's also important to recognize that we do have a lot to be thankful for in what we have access to. We are so privileged to have access to this highly effective vaccine. That's not true for most people in the world still. And I think we owe a lot to one another. The fact that this is a communicable disease, we travel together on this, and the fact that people are covering their faces, getting vaccinated, respecting one another, is really that collective impact has led to our collective success. And so if we want to thank anybody, it's really turning people that are around you at any moment and expressing that gratitude because it's something we've done together.
Well, perfect, Dr. Willis. Well, thank you so much. Unfortunately, we're running out of time here on the show. But again, thank you so much for being on the show with us today. It's been an honor to get to know you. And hopefully we'll get to have you on for the show again to give us some updates in the near future. And this has been Tay Radio Marin. We will catch you guys next week. Thank you all for watching, and we hope you all have a great weekend.
Yes.
Take care, everyone.
Bye, guys.
All right, thank you.